Hello everyone and welcome to our cooperative care webinar. My name's Leigh-Ann and I work with veterinary behaviour support as a client coach and trainer. So this webinar is going to be a brief overview, sort of a basic introduction on cooperative care, what it is, why we use it and sort of how effective it can be. So a quick introduction first of all. I am Leigh-Ann Bedding. I now work with veterinary behaviour support. I started full-time with Sophie in September. I started out my career working for the Zoological Society of London at their Whipsnade site, where I actually spent the first 7 years after sort of leaving college and stuff. This is where my love of cooperative care really begun. I'm sure a lot of you have seen the videos of some of the husbandry training that goes on in zoological collections, and just being a part of that was absolutely fantastic. I predominantly work with birds for free flight demos, but our birds are all trained in cooperative care in some way, shape or form as well. This can be something as simple as sort of claw clipping and foot care, right up to getting birds to stand for x-rays and taking sort of conscious blood draws from one of our eagles. So that sort of really sparked my interest in it and how we could work with these animals without the need for fear, restraint, medication, stuff like that, how we could just really work to make these experiences as stress-free as possible for them. So I then decided I wanted a bit of a career change, and I took a job working as a trainer at Dogs Trust. This is where I first met Sophie. I spent 4 of those years as training behaviour advisor. And in this role, I sort of oversaw all of the training behaviour of the dogs in centre, as well as some sort of post-option support and other things that were involved in that as well. And one of my really strong interests was implementing cooperative care with the dogs in our care to make their veterinary experience nicer, less stressful, and also to help with their rehomability, because it's far easier to rehome a dog that has a really consistent plan on how sort of vet visits are going to go, rather than a dog that we know is going to really struggle, need heavy restraint, need lots of medication and stuff like that. I'm currently working towards my animal behaviour technician qualification so that I can register with APBC. And as I said before, I'm currently working as a client coach and trainer with veterinary behaviour support. So my job role currently is to help our clients implement the behaviour plans that Sophie has put in place for them. So after her consultation, I'll go out and spend some time with the dog, with the owners, and really help them put those plans into place and develop them to make them easier to digest for them. So what is cooperative care? Cooperative care is all about consensual handling. So we talk quite a lot about consent, and we'll get onto that in a moment. But it's basically a way of teaching animals to be an active and willing participant in the handling. So we want them to really enjoy this. We want them to become part of it, and it to really just be a fun part of their training. It allows them to have a sense of control. They can opt out of uncomfortable handling in a more safe and appropriate way. So we teach them ways of saying, I'm not comfortable with this, can we stop? So that they can move away without having to escalate the behaviour and without having to utilise sort of aggressive responses. It introduces a lot of predictability as well. So we teach all of the dogs cues for everything that we're doing so that we can tell them what we're doing before we do it. It just takes away that fear of the unknown and that uncertainty about what's about to happen. And cooperative care is not just for dogs with behavioural challenges or those that utilise aggressive behaviours. It's for all dogs, all animals. We can make vet visits a lot less stressful for everybody if we teach them all of these things quite early on. We work with puppies, so we can help people with new puppies implement this training so that they can really get their sort of head around the handling and stuff before they have to have these stressful experiences ongoing. Dogs that are just beginning to show some sort of fears and worries at the vets, that's the perfect time to start working and implementing this training before it's become a really ingrained behaviour. So consent, what is it and why is it important? So consent should be freely given, no coercion. So we're not luring the dogs, we're not trying to distract them with food, they know exactly what's happening. They're not coerced into doing it. It should be reversible. So at any given point, they should be able to say, oh, I'd rather not do this anymore. I'd like to stop now. Obviously, we completely understand that in veterinary practice, this isn't always possible. Dogs need treatment. Sometimes we have to just get things done. But all of our training sort of leading up to these appointments and stuff should be consent-based so that the dogs are more confident and comfortable in what it is that they're involved in. It should also be informed. No trickery should be involved. So what we mean by this is, we shouldn't just quickly toss a handful of treats on the floor and then try and do what we need to do, or while the dog's asleep next to us, quickly try and clip a claw. Because if we're quickly tricking them into doing things, we're not working on the emotional response that they're feeling. We're not helping them sort of feel more comfortable at it, and they're not able to consent to that. It should be enthusiastic. We want all of our dogs to be an enthusiastic participant in our training. We want them to join in and enjoy themselves while they do it, because they're much more likely to join in if they feel like it's fun. And it should be specific to the activity as well. So just because they're okay with doing something in one location doesn't mean they're not going to be okay doing it in another. Just because they're okay with one bit of handling doesn't mean they're okay to do with it elsewhere. We all know dogs that are completely comfortable and fine with handling in most situations. As soon as they get to the vets, they absolutely panic and freak out. So that means that in that situation, they may not want to be handled and they may be more fearful. So teaching an animal a safe way to stop handling is likely to reduce the risk of aggressive responses. So if they have an option to say no and they have an option to remove that consent, they're less likely to utilise aggression if they do become worried, because they already know, if I just do this, everything stops. So having that option to say no, we often find also encourages them to opt into training. So we quite often find that because they know that they can choose to move away and that we're going to stop if they become uncomfortable, they'll actually give it a go. They'll have a try and they'll see how it goes. It's a much easier way of sort of changing that emotional response if the animal knows that they can stop what's happening. It also builds their confidence, because again, they have the option to change what's happening to them. They have the option to say no and move away. Having that sense of control can help them feel far more confident in these situations. So safety is a really, really important part of our training. Obviously, safety is important with any close handling. That's not just the safety of the dog, that's the safety of the owner, the safety of the groomers, the vets, anyone else who might be handling this dog. That safety is sort of our number one priority. Dogs are more likely to become panicked and distressed with a sort of really full restraint. If we're really having to hold them tight, holding their collar and harness and like pulling them in close to our body, they're far more likely to be panicked if that's happening. Also, the addition of unconditioned equipment, things such as muzzles, towel wraps, cones, things like that. All of those things, if they've not been conditioned to them before, especially if people they don't know are putting them on them, they're going to become far more panicked and fearful and more likely to utilise those aggressive reactions. So muzzle training is a really important part of cooperative care with any dog that's previously used aggressive responses. Any of our dogs that have shown aggression at the vets, and by aggression, that can include sort of growling as well, because that is a precursor to a bite incident. So any dogs that have growled, snapped, become really, really panicked, we're going to prioritise muzzle training, just so that we know that we can keep everybody safe in that situation. That's not to say that a dog always needs muzzling. It doesn't always need muzzling. It won't necessarily have to wear the muzzle in public. Things like that may just be to these specific activities that we're doing. But having that training there is really, really beneficial. And at times we might use it as a little bit of a preventative measure. Dogs that show really sort of high levels of fear and discomfort, having that muzzle training in place already means that if they do ever get to the point where they do have a little snap, become really panicked and unsure, well, it's already there. We've already trained it. It's a tool that they can already use. So all of the dogs that we work with would also be trained for some sort of light restraint, regardless of whether they're muzzled or not. Obviously, muzzling means that they can't actively bite you. However, a dog that's thrashing around and panicked, if they hit you in the head with that muzzle, it still does really hurt. So, they're always going to be trained for some sort of restraint as well. We generally tend to look at like a collar hold or an attachment to the collar that we can hold nice and tightly, so that, if the dog does panic and go to swing its head round, we've got control of their head in those moments. Sometimes we might do a little bit more of an involved restraint that we teach them. Things like blood tests, it's going to be far easier if we've sort of got the dog a bit more still, but that will always be a trained behaviour. It's something that we'll work on in our training. And training for cooperative care and ensuring the animal understands what is about to happen to them is going to reduce the fear and distress during handling anyway, which is going to help us reduce that chance of an aggressive response. That doesn't mean that by doing this training we forget about all the other safety that we've got in there. That's always going to still be a big part of it. But using the training will hopefully help us reduce the chance of that happening anyway. So just a quick bit on sort of muzzle styles and the fit of muzzles. I love muzzles. I think they're absolutely wonderful tools. I know they can be very, very difficult for our clients to find muzzles that fit appropriately. We want to be using basket muzzles. These basket muzzles mean that the dogs can pant and drink and take treats and things through them. They're far more comfortable for the dog. They're far safer because we don't have that risk of overheating. Dogs, when they're really, really stressed, they're going to pant wider, they're going to pant bigger. And by being able to do that, it helps them feel more comfortable. We do generally prefer the muzzle movement muzzles at Veterinary Behaviour Support. One of the big reasons is because they're a very, very ethical company. They are completely force-free, and they will only work with other companies that are, which is fab. But also, the design of them, they're pretty, which always helps. But they've got these wonderful treat holes in the front, which makes treat delivery really easy. They've got fantastic amounts of pant room in all of their muzzles. They do some great sizes for large breeds. That's something we really struggled with before muzzle movement was around. Our larger Shepherds, Great Danes, Cane Corsos, all of our bull breeds. Fitting muzzles on them has been really, really tricky up until this point. So having these options is great. The sort of accidental bonus of the muzzle movement, particularly in a vet surgery, is that the ET tube can fit through that treat hole in the front. So when dogs are coming around from anaesthetics, they can have the ET tube in whilst they're still muzzled. So it does have that added layer of safety for them. Muzzle movement do professional packs. I know there are a few vet practices already that do use them, but that is something to be aware of as well. But they are really, really wonderful companies. So what can we achieve with our cooperative care training? I think the key thing really is that every dog is different. So all of these dogs, they have, different life experiences. They have different medical conditions, different genetics, different temperaments. Everything that comes together gives us a really different picture depending on the dog. Now, that's not to say that dogs who have had really traumatic experiences, have ongoing chronic painful conditions, and those sorts of things can't be worked with, because we absolutely can. But it does mean that, this is why we have different plans for different dogs. This is why we do everything differently with each individual, because we have to work with those limitations and sort of help work around them. The three main things we tend to start with for veterinary care in particular is injection preparation. Generally, we start for vaccinations, because that's normally when people have got in touch with us, because their dog really struggles at the vets, they really panic, and vaccinations are coming up, and that's a really stressful time for them. So that's normally one of our first things that we do, along with stethoscope training so that we can listen to their heart, and general touch acceptance, so we can sort of handle the dog in different areas of their body. This just kind of gives them the basic sort of setup, and then we can tweak it to each dog for different things that they've got going on. So I've just got a quick video here of the lovely Hank. Hank is a 2-year-old Weimaraner. He's had a lot of ear infections and skin problems throughout his life. He really does struggle with his veterinary handling. I think that the pain that he's had in his ears previously has meant that he's got a really, really negative association. So over the last year or so, he actually hadn't set foot into a consultation room in over a year because of how worrying he found it. His owners had done some work with getting him into sort of reception, and the vets, when he was going for appointments, they were coming out to see him in the car. He's always had pre-visit meds, and he's also had like injectable sedations as well, sort of help that handling, because he's just become so panicked and fearful. So we've been working for a little while on sort of his general handling and things like that. And we're just now working in the vet practice. We go in there every other week, and we spend some time in the consult rooms, and we're just starting to put the training that we've done at home in practice in the vets. So here we're just doing a pretend jab. So we've told him that we're going to take hold of his collar, which he's absolutely fine with, and he's really relaxed about. His owners then sort of tented his skin on his neck, giving him a little poke. As soon as we've done that, we then mark and release him so that he has that freedom to move around. Obviously, if we were in an actual vet visit, he'd have a lead on him as well. We'd have like good control over him even when we're not handling. Because this is just a training session, it's just me and his 2 owners in the room. We know Hank really well, so he's absolutely fine with that. But it just shows that, he hasn't been in that room in well over a year. We've managed to work through that fear for him and help him be more comfortable and confident with us handling him while we're in there. So some of the more intrusive veterinary handling that we tend to find comes up as a bit of an issue as well is things like oral examinations. It's really difficult if you've got a dog that has used aggressive behaviours before and needs to wear a muzzle in the vets. It's really, really hard to check their teeth, and obviously we know that dental disease can be quite a big problem. Ear examinations, sorry, my words are going today, including using an otoscope and sort of getting medications in there, because we know, again, dogs who have chronic ear infections, this can become a real problem for them. eye examinations and eye drops, depending on the dog, you know, we can work towards being able to look in their eyes, touch around their eyes, moving their eyelids about, things like that, and build up to using eye drops, especially if they have chronic problems and need these sort of reliably. It can make life far easier. Abdominal palpation is one that a lot of dogs struggle with. I think it feels a bit weird for them. So again, that's something that we can practice and something we can teach them at home so they're used to it. Another thing that we do quite a lot in kennels, that we don't do quite so much out in sort of general practice, is creating specific behaviour plans to prepare for post-operative care. So if we had dogs in that, you know, were a little bit unsure at the vets, were a little bit worried and did sort of struggle with their veterinary care, if they had to go for operations, we would put behaviour plans in before that if we had the time to enable us to give them better care afterwards. So for example, we had a lovely dog de Bordeaux who had really chronic eye problems. She could barely see when she came into kennel. She really struggled. We knew she needed to go for entropion surgery, and we knew that was going to happen within a month or so. She had to gain some weight first because she was in a pretty bad state when she got to us, so we had a bit of time to work on that. And we immediately began working on muzzle training so that everyone could be nice and safe, as well as sort of the eye handling that she'd need for sort of any of the surgical stuff and post-op care and building up to eye drops. So, you know, we can think ahead there and help these dogs before they go for their surgery so that we can give them the best chance of success afterwards. This is just a short video of the lovely Sherlock. He's a Cocker Spaniel who really struggles with his handling. He, again, has had some ongoing ear issues, and he does have seasonal allergies that go along with that. He's really worried by grooming, handling, vets, anything formal. If you're just casually giving him a fuss, he's cracking. But as soon as he thinks anything else is going on, he does get a little bit worried, bless him. So here we've just taught him to position his nose in a target and let us lift up his lips. So this is quite early on in the training of it. Eventually we want to work towards being able to, you know, lift the lips up towards the back so we can see the molars. And then we've also got plans to sort of get them to hold on to something so that we can see inside the teeth as well. And this just means that, you know, owners can do this for you. They can show you the teeth. We can get them to sort of open the mouth up and sort of have a good look around, get videos for you if needed, so you don't have to directly handle the dog's mouth if they have previously used aggression at the vets. So just a couple of other videos that we've got here. We've got Hank again, and we are working towards desensitizing, ear handling and using an otoscope whilst we're at the vets. We've worked through ear medications in the home and he does really well with that now. He's more than happy for his owners to put ear drops and things in whilst he's at home, but we're still struggling with the vets being able to look in his ears because that's obviously previously when it's really hurt him. So we've worked on desensitizing the otoscope itself so he's comfortable seeing it, because at first, as soon as we got that out, he would try and run away because he really didn't like it. So we built a nice positive association with that, as well as a positive association to the ear handling itself, and then we've brought the two together. We're now practicing whilst we're in the vets. So as you can see, he comes over, I cue ear so that I can have a little look in and have a peer around. What's really interesting about this video is he actually goes to opt out. So I ask for his ear again and he, for a second, goes, oh, I'm not sure. He goes to step away and then he's like, actually, no, I can do this. So I'll just play that through again. So we have a little look in the ear. He does really well. He gets his treat. And then I ask again, would you like your ear? He's like, oh, I'm not sure. And he's like, actually, yeah, I will come back and do that. So it just gives him that second to think, you know, if he does step away, that's not a problem. It doesn't matter. You know, we can go back to that another time. It's not an issue. But because he knows that good things are going to happen and he has that choice to say no if he wants to, he does come back in again. And the other video I've got is the lovely Lennon. Lennon is a Labrador. He was a lockdown puppy, so his socialisation period was quite varied, bless him. He finds the world quite scary. He's worried by strangers, he's worried by dogs, he's worried by handling of people he doesn't know. He particularly doesn't like eye contact and being spoken to. So one of the issues he's had in the past is his owners have told people, you know, he is worried by people, and they've immediately done what a lot of us do, which is crouched down and gone, oh, Lennon, it's okay. And he's gone, oh my God, they're looking at me. I really don't like that. So, you know, when he comes into the vets, his owner's very good at sort of explaining to the vet first, please don't crouch down, please don't look in his face, give him a moment and give him some space. because that's something that really does worry him. And Lennon's owners have been working really hard with me on teaching him all of this handling at home so that he expects it when he comes to the vets. And this is actually the first time that he's managed to have his 6 monthly check with sort of hands on. Normally he goes in and, kind of look at him from a distance and sort of assess what they need to. And if he's ever had to have something done, he's been sedated for it. So he is really worried during this. He didn't want to take food while the handling was happening, but between bits of handling, he was more than happy to come and take snacks. It's still a work in progress with him. But previously, he would be growling, he would be thrashing, he would be trying to get out of the way. But he's calmly allowing the vet to listen to his chest. You can see he is stressed, he's panting, he's a little bit worried. And then as soon as the vet comes away, we all had a little Lennon party. He got all the snaps. He thought it was the best thing in the world. And then he was more than happy to come back into position and be cued again to be held by the collar for the next bit of training. So this was a really, really huge win for Lennon and his family. He did amazing with this. So we've also got some general husbandry training that we can work on as well. So some of you guys might have clients coming in and saying, I really can't groom my dog. They won't let me brush them. I can't get them in the bath. Can't shave them if I need to. They can't go to the groomers. Claw clipping is almost impossible and things like that. So, those are all things that we can work on and we can help with. And this is just a short video of Duchess. She's actually my own dog. She is fast asleep on the sofa next to me right now. And Duchess came from a hoarding case that was seized at the start of last year. There was 191 dogs found in a property down in Devon, and she was one of the many. She spent some time in the RSPCA holding kennels before coming into Dogs Trust. She unfortunately developed quite a severe skin condition whilst she was in our care in kennels, which led to us having to do a lot of sort of forced veterinary handling where we just had to get this treatment done with her. She was very shut down. She spent a lot of time just sitting in a bed in the kennel, hiding out away from people. She didn't want us to touch her. She didn't want any contact. It took us months to even get a lead on her. I took her into foster towards probably about a year ago now, actually. And she stayed with me while we worked through some medical stuff. And then she never left and we've officially adopted her. So touch acceptance and handling for Duchess was a really, really big thing. Considering all the stuff she's had to have done to her. She's never once utilised aggressive response, but she was very shut down and she would just sort of, everything would be tense and just do what you need to do and then leave me alone. We couldn't get her to go into the vet room for months and months and months. She now happily goes into the vets. We pop her up on the table and she'll let anyone do anything because she gets to eat some liver paste while she's up there. Her food drive makes her very handy to work with. But yeah, she's done really well with all of vet training. But one thing that we were struggling on was claw clipping. Her claws grow incredibly fast, particularly when she was less active when she was in kennels. And she did, unfortunately, somebody did catch the quick on them at one point, and after that she was like, no, don't touch my feet. So we've worked on building that up slowly but surely with her. And one of the bits that people tend to struggle with is the back feet, because the dog always wants to look at you when you're doing their treats. So we've had to teach her to do it down, angled away from us, so that we can get access to her back legs and do it. Sometimes you can do this with a second person, it can work either way. But it's one of the things that we've really worked hard on with Duchess, that we're able to do this without having to hold her, without having to restrain her. We can just do it. She's happy to sit there while we crack on. And as long as she gets a snack in between, she's more than happy. She also knows this is her handling mat, the mat that she sat on. It is just a bath mat. But she knows if at any point she steps off of that mat, the handling will stop. So she's more than happy to join in because she knows at any point she can say, no, I don't want to do that. And she does at times, if she's had enough, or if her feet might be a little bit tickly, if her skin's flaring up, sometimes I'll touch her feet and she'll go, no, and off she goes. And it's like, fine, that's not a problem. We'll try again another day. So it's just another nice way of being able to do things a bit calmly with them. I think So how would all of this apply to a vet visit? We've shown you all of this different handling. How do we actually bring all of that together? So we do a lot of desensitization and counter conditioning. Now, this can be to anything. It could be the environment, it could be to a vet standing in the room, it could be to me touching them, it could just be to general handling, holding the collar. These are all things that some of the dogs might have an issue with, and we identify where the exact problems are and how we can counter condition that response and make them feel better about it. So we'll do that with the environment and with the handling methods, and then we start to look at bringing them together. We'll introduce the muzzle training, make sure they've got a nice positive association with that. Now, one thing that we do quite often do with muzzle training as well is if the dog only needs to be muzzled at the vets, we still get the owners to practice it everywhere. Practice it at home, practice it when you go to visit your friend, practice it in the garden, practice it on your walk, all of these things to make sure that the muzzle is just a normal part of their day-to-day life. Because the last thing we want is to really well condition a muzzle, and then the owners pop down the vets and the dog's like, this muzzle means I'm going to the vets, doesn't it? And it then becomes like a precursor to handling happening. We introduce the different equipment and touch that will come in different ways for different dogs. Some dogs are happy to be touched already. They absolutely don't mind that. So we just have to teach them the way in which we're going to touch them for the vets. Some dogs might be really worried about touching certain areas, particularly things like ears and eyes. They can be quite worrying for dogs. So we might have to desensitize that and counter condition that first, and then bring everything in together. With sort of confidence in the environment, we may not even come into the vets for the first few visits. So one of the dogs I'm working with, Isla, she's actually going for her vaccinations tomorrow. When we first started our sessions, our first entire training session was in the car park, because dogs know the whole environment. And if they come into the car park and they're already worried, we need to work on that first, because if we go straight inside, we might not even get them there because they might not want to go. They might dig their heels in, panic, try to back out, try to pull away. And if they're that overstimulated and already over threshold, we're not going to get anywhere. So quite often we'll start in the car park, work our way to sort of the entrance area, make it into reception and sit and hang out there for a bit. And then, finally, if there's one available, we might make it into the consult rooms and start building their confidence in there. So at the end of all of this is where we bring it all together. So we've taught them to be more comfortable and confident in the environment. We've introduced all the handling methods and they know exactly what we're going to do, when we're going to do it. We've practiced it with different people. We've practiced it in different ways. We then bring it all together. So we'll introduce the collar hold while the dog's muzzled. We'll then add the handling in. We'll then introduce it while we're in the consultation rooms. We bring all of these steps together individually on their own so that they can sort of all pull together at the last minute. So how can you guys as veterinary professionals help? So the first thing is the ability for clients and trainers to build confidence in the environment. So, we can come into the car park, we can come into the waiting room, absolutely. But being able to use consult rooms is also really, really beneficial for sort of building up the training in the real life environment that we're going to use. Obviously, I appreciate you guys are super busy and that's really hard to do sometimes, but if you're closed over lunch breaks or you have quiet periods in your day that somewhere might be free, just before you open and get going on stuff, or just like before closing, if there's times where they might be free, then that'd be really fantastic. I do get all of my clients that need to work on handling at the vets. I ask them all to contact their vets and try and find out if they do have these time slots available that we can go in and use their facilities. Where possible, working with clients and trainers to aid in confidence building. Now, I completely understand and appreciate that you guys are really, really busy and don't have much time to sort of do these things. I get that. I totally appreciate it. However, where possible, it is really helpful, particularly towards the end of the training, when we're just building up the confidence, when we're just teaching them all the training and sort of the positioning and that sort of thing, we can do that by ourselves. That's not a problem. When it comes to actually handling, having that extra time to sort of train and build their confidence is really useful. But again, appreciate that's not always possible. So if you've got a dog coming in that is really fearful at the vets and does really struggle, chat to your clients first and see what's going to work best for their dog. I know, again, that's not always going to be possible depending on what the dog's coming in for. Sometimes things have just got to get done. Some dogs, like Lennon, he really doesn't like eye contact. He really doesn't like people crouching down to speak to him. That makes him more panicked than if they just ignore him and pretend he doesn't exist. So, be prepared. Like, if they do tell you those things, you know in advance, you're not going to accidentally upset him as soon as he walks in the room by going to have a chat with him. It just means that you can be prepared for that. Being flexible where possible in how examinations and appointments are run. So Lennon's issue is eye contact. He had conjunctivitis a few weeks ago, so the vet did need to check his eyes. However, knowing that that's something that may trigger a reaction in him, we did all of the other things that we thought he was going to cope with better first, so that worst comes to worst, we could have done the eyes at the end and abandoned ship and left. He wouldn't have had such a negative session. The other handling would have been much easier because he wasn't already really stressed. As it turns out, he actually did amazing with the eye examination. He did really, really well with that, but we did it at the end so that if that went wrong, we still managed to get the rest of the check in place. Planning entry and exit routes for reactive dogs. So if you've got dogs coming in that are dog reactive or stranger reactive, having sort of sneaky entryways. If there's any way they can come in through the back, they can sneak in through another door, so that they don't get flooded with all that stimuli before we've even tried to start. That can be really, really useful, because if they're already over threshold, they're already really, really stressed and trigger stacked, we're more likely to see a reaction happen because they're already sort of out of patience. They don't have anything left to sort of hold those reactions in. Early referrals can prevent problems becoming unmanageable. This is a really, really key thing. Behaviour support is not a last resort. We are here for those dogs that sort of we can't do anything else with. But getting those referrals in nice and early when the dog's starting to get a bit worried at the vets, or those dogs that come in and they want to hide under a chair, they don't want to come out, they don't really want to be touched, and they just sort of shut down and let you do everything. Working with those dogs before they become a real problem, or using aggressive responses, or thrashing around so we can't handle and restrain them. The earlier we can refer those dogs, the easier it is to work with them, the easier it is on the clients, the easier it is to sort of undo those negative associations, because they've not built up over time so much. Where it's appropriate to do so, consider pre-visit medications. They can be an absolute godsend for sort of vet visits and stuff. And if you want any support on that, speak to Sophie, give us an email. She recently did a really fantastic 5-part series on behaviour modifying drugs. It was really, really brilliant. So she can absolutely support on that as well. And welfare grooming. This is something that we tend to ask our clients whose dogs don't like to be groomed. Cockapoos and things, and they get really, really matted. We can work on all the training in the world, but if then as soon as we get the clippers on them, we're pulling on mats and we're catching on things that's really uncomfortable, or we're trying to brush through really long knotted hair, we're not going to make a lot of progress with that. We ideally need a blank canvas when we get started on it. So we quite often do suggest that they go in for a sedate and groom beforehand. We do generally ask this to be under general anaesthetic, so a lot of times under sedation the dog is physically sedated, but they can still hear what's going on. They still have some level of awareness, and we found that when they just have like a small level of sedation, the grooming gets completed. However, the dog has an increased fear of sort of clippers and grooming noises after that, so that can be really, really tricky. The slide doesn't want to change. So what is the Co-Operative Care Club? This is something that we've released at Veterinary Behaviour Support in the last few months since I've come on board with Sophie. And it has a range of packages, which we'll go through in a minute, but it is specifically for cooperative care needs. If the dogs have other behavioural challenges, we can of course see them. They can go through the normal referral process, have a full consultation with Sophie. I can still go out and do one-to-one appointments with them, and cooperative care can absolutely be a big part of that. But we just have to make sure we've addressed everything else that's going on alongside that. So the initial consultation process is with Sophie and myself, so that we can tailor that behaviour modification plan to the individual dog, the client, and the needs and abilities of the team that are going to be working with them. This then leads on to sort of in-person virtual support with myself to build on the plans, make changes where necessary. These sessions can be wherever they need to be. So I'm more than happy to sort of go to the vets with the dogs. I'm going for Isla's vaccination appointment tomorrow. I was there for Lennon's 6-month vet check. You know, I'm absolutely more than happy to come in and help out with those and sort of give everyone advice where needed on sort of how to make this easier on the dogs. So I'm absolutely more than happy to work where we need to with the dogs. It doesn't have to be at the client's home. And this can be used for dogs who already have challenges or struggles, as well as for the owners who want to ensure their dogs are confident and cooperative. So, you know, if you've got people coming in that just want to do some sort of extra training with their dog, or they want to look at some cooperative care training and handling, we can absolutely help them too. You know, they don't have to be dogs that are really, really struggling. You know, if we can help prevent these things from becoming a problem, even better. That's fantastic. So we offer 3 packages. We've got the gold, silver and bronze. The gold and silver are in-person packages. They have to be within 1 hour of the postcode that's on there. This is just because that's sort of the area that we can access while still being able to see plenty of other clients, because it can get quite difficult. So we initially start with a 1-hour video call with Sophie to discuss all the problems that the owners are experiencing. And the aim of this is to understand why the problems have developed, what emotions are involved, and what the specific triggers are. So from this, then we can write out the assessment and build up a plan within a week. And this will also be shared with the referring vet as well. So the vet staff will get a copy of this. They can see what we're doing, where we're doing it, how we're doing it. We then look at doing 8 45-minute training sessions with myself. Again, these can be anywhere as needed. They can be weekly, they can be every other week, you know, whatever works best for the client, whatever we can get booked in. After each session, it's follow-up emails to ensure that the client knows what they need to work on before the next visit. And we will support in the meantime as well. If someone comes up with something in between sessions, they just want a little bit of support on, we can absolutely do that. We'll help out as much as we can. So the silver package is very, very similar. It's just 4 45-minute training sessions with me. Again, if the clients decide, you know, if we come to the end of those 4 sessions, they're like, actually, you know, I could do with a little bit more support, I could do with some more help. Yep, that's fine. We can add on more sessions. That's not an issue. It's not they do this package and then we're done. You know, they don't have to worry about what if we're not where we need to be at the end of the 4 sessions. We can absolutely tag more onto the end of that as well. And the bronze package, this is available nationwide because it is a purely virtual package. You get the 1-hour video call with Sophie, and then we get 2 half-an-hour follow-up calls with me. Again, we can go through videos, we can go through the training they're doing, make sure that the clients are happy with how they're implementing the plans, troubleshoot any issues that might occur during training, and each call is going to be followed by detailed recommendations for like adjustments and everything else as we go along. So that is us pretty much all wrapped up. It's a very basic and brief overview on what cooperative care is, why we use it, how we use it, and everything else. So please do get in touch if you have any questions at all, any interest in the Cooperative Care Club, or you just want some more information on sort of how that's going to apply to any potential clients that you've got, then please do just drop us an email. That's absolutely fine. Equally, if you work in a veterinary practice and you'd like any support with implementing vet friendlies, you know, working with clients who are on cooperative care programs or anything like that, we can offer personalised CPD packages as well. So please do get in touch. Thank you all very much for listening. You know, this is something I'm very much passionate about, and I do understand you guys don't have a lot of time in your day for things like this, so huge thank you. And yeah, get in touch if you would like any more information. Thank you.